Good afternoon, everyone. Welcome to the meeting of the Health and Wellbeing Board on the 26th of June 2024. I'm George Dare and I'm the clerk to the board. We have some apologies for the meeting. So we have apologies from Mark House, Jan Britton and Anna Eastgate. Our first item on the agenda is to elect a chair for the meeting. Are there any nominations for chair?
As the Cabinet Holder for Adult Social Care, I'm nominating myself for this role. I'm really quite excited about it and what we can do. So let's see if it works.
And is there a seconder for this proposal?
I'm quite happy to second.
Okay, thank you, Patricia. Are there any other nominations? Do you have? No, you didn't have your hand up. In that case, as there's no other nominations, then Steve, you're chair of the Health and Wellbeing Board for the coming year.
Thank you, George. Is it over to me?
Yeah.
Afternoon, everybody. I'm quite new at this. I've been doing it for 6 or 7 weeks, and some of you have been doing it for months and years, or a similarly short time. So my ambition is that we learn from each other, and that this is the form of committee that actually we engage with each other with the right spirit of trying to get the best that we possibly can for our client groups. We have the opportunity, I think, around this table to influence many, many people, not just on behalf of Dorset Council, but because on behalf of all the constituent groups. And so, as I said at the start, I'm quite excited about the potential that we have with the people who are in the room and online, but also those who we might identify as needing to join us as we develop into the future. What we don't want to do is just replicate the past over and over again. So we now come on to the election of a vice chair, and I would like to nominate Patricia Miller as vice chair, and wonder if there may be a seconder, please.
Delighted to second.
Councillor Sutton.
Thank you.
Are there any other nominations? Then I believe that is agreed.
Yeah.
Welcome on board, Patricia.
Thank you.
So moving on to the minutes of the last meeting. Obviously, I was not there. Can I ask if it was a true and accurate record from people who were there, and if so, for a proposer, please?
To propose the minutes as I was here. Happy to second.
And second from John. They are agreed. Moving into the meeting proper for today, declarations of interest. Does any member have any declaration of interest they wish to make known? In fact, there's a no. The next item on the agenda, item 6, is public participation. We have, I believe, no questions received formally by last Friday, so that moves on. Councillor questions, again, no formal questions were received since last Friday, but I understand there will be some conversations and meetings that have been had during this meeting and following where we'll be able to move forward. Are there any other questions to raise, George, that you're aware of? No. Okay. Am I going too fast?
Nick?
Okay. There are no urgent items that I'm aware of. Okay. So the Better Care Fund is going to be presented by Sarah. This is a lot of paper, and it's very easy to just look through it and just say, yes, it looks great. But there's some challenging targets in there and some good things to report on. So over to you, Sarah.
Just before, with your permission, Chair, so my name is Mark Tyson, I'm the Corporate Director for Commissioning. I was going to just do a bit of intro before Sarah takes us through into the detail. So members who've been on the board for some time will, of course, be aware that this is a regular report to present a submission that we make to central government that talks about how we've used our Better Care Fund and our plans for the future. There's always a timing problem with it. I'll get that out of the way now so Sarah doesn't have to. And so it's often retrospective here, but a lot of work across health commissioning partners and Sarah and her team goes into kind of ensuring that the data is robust and the narrative meets the direction set by the Health and Wellbeing Board. And so I think just in terms of placing us where we're in, it's a 2-year plan, and so we're entering now the second year of that plan. And I'm aware that from the last Health and Wellbeing Board, several conversations about how we might develop the Better Care Fund for our purposes going forward. And I think this year is, given that it will come to an end at the end of next year, we'll understand what the government requirements are for the future 2025-6 onwards. And then we can perhaps start doing that work properly to understand what the long-term future looks like for this and how it supports our strategies. But Sarah, do you want to?
Yeah. Thank you. Good afternoon, everybody. So I'm Sarah Sewell. I'm Head of Service for Commissioning for Older People and Home First. So I've just got a few slides. It'll be a familiar layout to kind of long-standing members of the board where I've brought these items before. So we've got 2 plans, as Mark referenced today, seeking retrospective approval of, which is our plan from last financial year 23-24, and then moving forward into the next financial year. Okay. So as we kind of referenced, so we've got a 2-year plan, planning cycle this year, so from 23 to 25, that governs our spending. And to date, we've brought, I've just listed there the 3 reports that have come to the previous 3 meetings that the board have ratified. So the assurance checks we've combined into this retrospective approval, as I've outlined below. And just to reiterate, the objectives and the framework haven't changed. Those policy objectives from the BCF still echo our local shared priorities around enabling people to stay safe, well, and independent at home for longer, and provide the right care in the right place at the right time. The framework continues, as I say, in line with previous years. So we have to meet some national conditions, and we have to have performance metrics that we report against. And in terms of the totality of funding for Dorset, the BCF fund brings around about £153 million into our budgets for this financial year. So the main sort of bulk of the information is within your report packs at Appendix A and B. It's a similar format to previous submissions. Appendix A is the end-of-year report for 23-24, and B is the forward-looking planning template. So both of them consist of sort of the same elements, looking at sort of slightly different periods of time. So we've got confirmation that the national conditions have been implemented. We're reporting against those metrics and the forecasts of our performance for the year ahead. We're giving details in there about our expenditure and the outputs that we've either achieved or are expecting to achieve. And there's a big focus now for Better Care Fund around our demand and capacity planning and the resources that we have available to meet hospital discharge and our community needs. And I've just listed there those 5 performance metrics that we report against. So you might recall updates previously about our performance, so that those areas haven't changed in terms of the focus. So our performance for the last financial year, so we met our targets as we expected to around discharge to normal place of residence and falls. But we've continued to be challenged in the areas of avoidable admission, our rate of permanent admissions to residential care, and the number of people that we're being able to support to remain at home 91 days after they've been discharged with reablement. So we talked about sort of the details and the reasons for that in detail before, but just to kind of just give you a couple of headlines as to what we're focusing on going forward for our new plan. So in the avoidable admissions space, we continue to see that increased demand for urgent emergency care. We do have plans around prevention-focused work streams in place to really to reduce those preventable admissions. And examples of that would include step-up frailty wards and improving the connectivity between the existing offers in the community so that we start to develop more robust avoidance options for the population of Dorset. In terms of the residential admissions to care homes. So we've managed to maintain our performance during Q4 in line with our sort of plan trajectory, and our plans are in place to sort of keep us on our trajectory. We did bring back in November of last year a bit of a deep dive into that residential care admissions target. And I've made reference and included the link on the report if there's any information needed there. And just in terms of the reablement target. So we've talked before at this board about the struggles that we have with availability of therapy support, which is challenging some of our reablement ambitions. We do also have the added pressure or the context of acuity is rising on admission. So people are living with more complex conditions. So therefore, when people are discharged from hospital, their needs are likely to be more complex, which may result in changes after they return home, which could mean that they're not able to remain at home or need to be readmitted to hospital. That being said, our discharge to assess offer is something that we're proud of. We've worked well as system partners to really develop that offer. We are supporting far more people to get home more quickly and to remain at home. And we have included also our performance around our trusted providers work in the Recovery and Community Resilience Scheme that we have as a line of the Better Care Fund going forward. So just my last slide here is just around the demand and activity. So as I mentioned, both the returns required updates on our actuals and our forecasted demand and activity. I've kind of listed on this slide just those sections of Appendix B that are probably of most relevance looking forward to the current financial year. We do have some live work underway, so we've got support in as an ICS from the National BCF Support Programme. That is a structured approach to 2 work streams. So we're looking at our discharge to assess pathways. So that's looking at how they're working, identifying options for how we might improve them going forward, and also looking at our leadership approach. And so as a system, how that approach could be strengthened so that we can work together to really drive forward positive change for our intermediate care going forward. It may well be that the outcomes from that work require us to kind of relook at our demand and capacity modelling as we start to shape our intermediate care model. But that's live work that's in train at the moment, and we can obviously bring those updates back to board as necessary. So just to conclude, the recommendation to board today is to please retrospectively approve the Better Care Fund 23-24, which is the end of year plan, and the 24-25 plan in your report pack of Appendix A and B.
Fantastic, thank you. Any thoughts, comments? Tricia.
Thank you, Steve. Thank you for that presentation. That was really helpful, and the report is long, but it's thorough. I think there's something about, first of all, the authorisation process. It's never really sat comfortably with me that we agree this retrospectively, and whilst officers sign it off, I think we need to find a way, even if it's only of the Health and Wellbeing Board agreeing it virtually, because it's very difficult to assure and scrutinise something that's already been signed off and sent to government. So I think we need to think about that in terms of the governance process around the Health and Wellbeing Board. The second point in my head is, it's fine that we use the national template, but for submission to the centre, but I think we need to think a bit more creatively about how we present the actions and get the right assurance around the Better Care Fund expenditure into the Health and Wellbeing Board. And what I mean by that is we need to be clearer on the problems that we are trying to solve and how far the Better Care Fund is moving in terms of progress of resolving those. I find it really difficult to follow because we don't necessarily link the challenge or the issue with the action and then the outcome, and know whether we've still got a gap in assurance around those issues. So I think we need to think really carefully about that. And we will, as we have no choice in health, whether we are getting more and more scrutiny from the national team about what we're investing in out-of-hospital services and whether the community are getting value for money or not from the health investment. So we will need to start to scrutinise a bit more closely what happens in terms of the Better Care Fund, what it's spent on and what it's actually delivering. Because that's an expectation from the centre. So we'll need to start to treat it a little bit more like some of the other contracts that we've got, rather than simply a sort of pass-through payment for services to be provided on behalf of the community, because I think we will start to get more scrutiny on whether what we're investing is actually making a difference in the areas where we would expect. But having said all of that, we have an excellent relationship with Dorset Council colleagues. There is definitely a sign of further integration going forward. And the way we work in this space is just a really good example of that. I think we just need to tighten up some of our processes and governance so you're clear as a Health and Wellbeing Board what actually is being delivered as part of this investment and the impact that it's having on the community.
I think that's a good comment. I'd agree. I think it's quite useful as well, because this is a good news story we've got to tell, I believe, to identify KPIs and monitor how we're performing against critical KPIs, as well as have all the data. So actually we get some stuff summarised. That would be actually quite a useful way forward. Jill, put your hand up, I believe.
Good afternoon, it's Councillor Jill Taylor, and I'm the Cabinet Member for Public Health, Environmental Health, Housing, Community Safety and Regulatory Services, or better known as the Cabinet Member with the longest title. Just a thought on this. I think you're absolutely right, Patricia. And I think the Better Care Fund, I don't know whether George can help on this. The Better Care Fund quite often comes to scrutiny, people and health scrutiny. Would that be a way for this to go so they can have a look at it, particularly going forward with the changes that were being proposed? Am I right in thinking it used to go to scrutiny, George?
Yes, I believe it has gone to scrutiny before, but I wouldn't say that it's gone recently. And it's something that you could refer to for the scrutiny committee to look at if you'd like to.
John.
Okay.
Jonathan Price, Exec Director for Adults Health and Housing. I think it has gone to scrutiny in the past, but it may be useful to go to overview as a new iteration starts to be developed for next year, because I think that's where you can really have influence and shape around a new Better Care Fund, hopefully a 2-year piece as well. So that might be a more appropriate route for that as it develops. But certainly this one could go to scrutiny as well for the last 2 years.
Patricia, do you think that would be something that would work?
Yeah, I'm fine with that, as long as then there's something that comes back to Health and Wellbeing Board members to say that what the outcome of that conversation has been as part of the assurance process. So yeah, I'm fine with that.
Thank you. Sam.
I'm Sam Crowe. I'm the Director of Public Health for Dorset Council and BCP Council. I thought Patricia's comment was really helpful, and it related to a point I was going to make about the paper about some of the detail. But it's not necessarily for the Better Care Fund to solve. And I think sometimes that's the issue, isn't it? This is a process. We see the metrics, we see the money. Sometimes the solutions to some of the challenges lie outside of the conversations happening in this room. The one I was going to ask about, which I think is absolutely key, is re-enablement and re-enablement performance. And that's linked with the availability of therapy and therapy specialists, which is an integrated care system workforce issue, and how our different providers are using their teams, and this sort of tension between resourcing the community and resourcing what's happening around, discharge and admission in the acute hospitals. So I do think over time we need to get into some of those challenges and keep the focus on the challenges, but a bit of a clearer idea as to where some of the business might actually take place to get into some of those solutions. Because it won't necessarily be through Better Care Fund mechanisms, but we should use the conversation in the board, I think, to surface that and to try to drive it if we can.
Effectively creating models that then we can prove, and then if they work, generate additional funding for.
Or at least raise the issue, and then if we can have a conversation in the system about where is the oversight of the progress that's being made around the development of that workforce and how it's deployed. That sometimes I feel it's quite difficult to track that through in the different things that take place. That really stood out for me, isn't it? How much influence do we have in this board to really shape that when it's a pressure throughout the rest of the system?
Thank you. Any other?
Can I just ask, do you feel there's any crossover? Sorry, Carol Jones, Stonehenge Newton, keep forgetting that. Stonehenge Newton, the metropolis of Dorset. Is there any crossover between the Better Care Fund and what we're going to be talking about a little bit later on, thriving communities, after it's all, there's sort of links, and I just wonder whether we should be looking at the whole thing more holistically rather than putting them in separate pots, really. I just, what are your thoughts there? Because to me, there's a lot of crossover that can happen in the community to great benefit.
So I think that the short answer is yes. I think said before that the Better Care Fund, can be a vehicle for all change. We only limit what's in there through our NHS and local authority agreement at the moment. So there's much more scope for things to be added and linkage to things like thriving communities, which will help with prevention. Indeed the sort of ICP strategy, that could all be part of a reframed Better Care Fund moving forward. So I think possibly it's something that the board might want to consider as a topic for a development session, because I think we have a kind of governance route through the Health and Wellbeing Board, but agree with Patricia, it doesn't match up all the time, and in these meetings we're not really given the scope to have that broader discussion about what could it be. So I think that might be something the board wants to consider as well.
I have had conversations with John before about maybe outside these meetings we need to be having conversations and maybe form a strategy day or discussion day where we can just sit down over coffee in a non-formal situation and just explore what could we do rather than just constantly do the same thing.
Yeah, Simon Rowe, Chair of Dorset Community Action, representing the voluntary sector. Just want to echo what you said, actually, around engaging with communities and the voluntary sector. I know that after the last time this came up, as Sarah, there was a follow-on actually with somebody from Stoney. I'm not quite sure the outcome because I haven't been in touch with them. See them tomorrow for an update. But I absolutely think it does. It's not just in prevention. I think it's when people are discharged. It's about keeping them in the communities and getting them over that 91 days. And some communities are, by their nature, very, very different across Dorset. But I think for some communities, it could work very well to engage them. And I'm sure that'll be partly reflected in the Thriving Communities output.
Absolutely. Patricia, your hand is up.
Yeah, thank you, Steve. So just in the context of that conversation, I think that in reality, what we need to be focusing on the Health and Wellbeing Board is, the delivery of the health and wellbeing strategy, but through place. And everything we've got on the agenda today really filters really nicely into what the place work programme needs to be, whether it's what we're talking about now, whether it's social mobility, whether it's thriving communities. They are all arms of delivery in terms of the place conversation. So my suggestion will be that maybe having a broader meeting, a strategy planning meeting, is a really good idea, just to refresh our memories on what we think we've agreed last year as part of the place plan, and then understand where the different components of work that are going on across Dorset Council's boundary filter into the delivery of the place programme. And then we'll be really clear as well if we've got any gaps that we might want to cover off, and also starting to think through how that also connects to the broader work of the Integrated Care Partnership.
Definitely, yes. I think that is a useful point to bring the discussion to a close. We need a proposer and a seconder, please.
I'm happy to propose.
Seconder? Second.
Everyone's in agreement.
Is everybody in agreement? Thank you. Everybody is in agreement.
No, we don't get a vote.
I'm sure that won't stop you.
I just can't vote.
Moves on to item 10, pharmaceutical. When you try to say something properly and you practice and it doesn't work, the PNA, as it shall be known, it's very weird moving slightly out of social care setting because the acronyms just jump out at you. Just think, what does that mean? So all the acronyms that are in the social care stuff, I'm quite comfortable with. Carry on. But with the more clinical papers, I could really use a help sometimes. Who's presenting this, Jane?
going to present today on behalf of Jane Horn, the consultant in public health who leads this work, but Jane is covering another meeting for me, so I've agreed to present her paper. So I think best thing to do is to think about this paper in terms of introducing the process of the pharmacy needs assessment. Is a statutory duty of the health and wellbeing boards. We have to carry it out every 3 years or so. Essentially, it's an engagement and data gathering exercise to look at the state of community pharmacy services right the way across Dorset Council and BCP Council. A key point in this paper is that we've obviously, as a public health service, done this on behalf of both health and wellbeing boards for a number of years. We're now at the point where one of the councils has served notice on the current shared service agreement, but that work's going to take a bit of time to complete. Our feeling as officers is that we would very much like to continue to do this work in common across both boards because it reduces duplication. It is quite an administrative task to get all the data together. But the paper also makes the point that when we're starting to think about pharmacy services, we do need to zoom in on how well they're serving individual neighbourhoods and places. So there will be a single exercise, we hope, going right the way across both boards that will give you that pan-Dorset vision. But it's really important that we have those conversations with people who care about community pharmacy, care about their neighbourhoods, and get that local, very place-to-face view as well. So one of the recommendations in the paper that Jane's buried in the text, which hasn't come through as a formal recommendation, is that we would start to do this through the emerging footprints around the integrated neighbourhood teams. And I think that's really important because if we're starting that journey of integration, making sure that community pharmacy is part of the picture will be really, really important. But to go back to the point of the pharmacy needs assessment, the Health and Wellbeing Board holds the duty. We prepare and publish the needs assessment, but I was just going to make the board aware that actually we don't have many more powers other than to publish that assessment and to make the system aware where there may be gaps in coverage. And that's essentially what this is about. So it's a bit of an audit of what community services are providing, the types of hours that they're offering different communities, the types of services that residents can expect. We put all of that together and we make an assessment where we have concerns either about the current provision of pharmacy or the future provision of pharmacy. That's then used by the commissioners of pharmacy services to then respond to that. And effectively, it's used as a way of governing the entry to the market. But we don't have commissioning power. We don't hold the budgets. And we don't have any influence over the commercial decisions that happen between providers and commissioners. And I'm just making that point because we have had a big change in community pharmacy provision, particularly since the pandemic. Partly that's because of decisions by some national chains to reduce their number of pharmacies that they've had, for example, in supermarket chains. But there is also a workforce shortage nationally, which is also playing into some of those decisions. So in some communities, the conversation about community pharmacy has been much more important because providers have withdrawn, and then it's led to this question of what constitutes a gap in service. So the other context that Jane wanted me to bring to the attention of the board, which isn't covered explicitly in the paper, is that we will be starting to consult on what constitutes a gap in service. There isn't any hard and fast guidance on this. There's guidance that's published nationally that suggests that you might want to use something like a 20-minute drive time, for example. That's not really relevant for all of the different communities right the way across Dorset. So what we would want the support from the board today is that when we start to do the consultation and engagement around the pharmacy needs assessment, we start to talk about a number of other criteria, which might include things like access to a car. It might include comments about the physical accessibility of some of those pharmacies. And there are also changes in the market. So there are more online providers, there are more pharmacies offering postal services, for example. So it's changing quite quickly. But I think all we're looking for from the board today is an appreciation of the scope of the pharmacy needs assessment, the commitment to continue to work together, because I can't see any other way of doing it, to be honest. And then just to note some of the timescales for the various stages of the process. And if we could have a brief conversation as a board about that issue of 20-minute drive time and whether we broaden some of those criteria in the pharmacy needs assessment, then we can make some better targeted statements, particularly if we're going to talk about the issue of pharmacy provision in a particular neighbourhood. And I think that would be more helpful than just something that's quite broad brush, and it might be meaningless to someone who's struggling with mobility issues, for example, and doesn't have a car. I think that's probably covered most of what I wanted to say. The other role for the board, which I haven't touched on and which I don't think is touched on in the paper, is that periodically, if there are changes in pharmacy provision, the board's role is to also publish a supplementary statement so that the document remains live. So we do this exercise once, but of course, as soon as you've published it, it's probably out of date. Periodically, we will come back to the board with important changes in provision, which are then published as a supplement through the board. So I'm happy to pause there and take questions. Over to you, Chairman.
Yeah, so Simon Raw. In the detail of it, is there an environmental impact likely to be assessed in terms of the services offered? And here I'm thinking of particularly a community service, not just for the provision of medication and prescriptions out, but the return of getting prescriptions and medicines that shouldn't be in people's cabinets back into pharmacies. I do understand there's a contractual obligation to do so, but I also know that is not always met.
So could I just check further what you're asking about? Are these the kind of issues about collection of unwanted medicines, the sort of whole issue?
Exactly. It's about people in the community trying to do the right thing and return unused medicines back to the pharmacy for appropriate disposal. And as I understand it, pharmacies do have a contractual obligation to take them back. I know on a practical note, that does not always happen.
Yeah, it's a really important question. And so there's something about the contract, which is between the commissioner and the provider of pharmacy services. But what I'll do, if it's okay, is I'll take that question away about, at a sort of pan-Dorset level, would the board wish to make certain statements about sustainability, impact on climate? What would that look like from the perspective?
Absolutely. It's the wider question. Thank you.
Yeah, no problem. I'll take that away. I'll double check we can.
Patricia next. Thanks, Paul Johnson, Chief Medical Officer for NHS Dorset. Thank you, Sam. So I guess what I'd like to see in this is a reflection of how the function of our community pharmacy has changed from when the last time this was done. So Pharmacy First, which many of you will know is a national drive for pharmacies to be able to manage minor ailments for people without them necessarily needing to see a GP or other healthcare professional, is coming online. To have that to identify gaps in that, because not every community pharmacy is offering it. And also, when you're looking at, is the coverage via a postal or a virtual pharmacy, that all that covers is the provision of medications. And because community pharmacy is now so much more within our communities, I think it's going to be really clear that there will be gaps in other services if that's not the case. And I think your point about a 20-minute drive, I think that's really valuable. And actually, the challenge, I guess, is, does accessibility need to be a single defined metric for all our populations, or is there a nuance, depending on what we understand about our different populations, that helps us describe whether something can be considered as accessible or not? And I know that muddies the waters an awful lot, but it probably is the best way, if we have the technical ability to do so, to look at accessibility for our population.
That's good. Patricia.
Thank you. So just to build on that point from Paul, I think there's a number of things that we might want to think about, whether they're possible or not through the pharmaceutical needs assessment, because given that we've only in April of this year taken on the delegation, this comes at a really good time to try and assess whether the current arrangements are suitable and whether the demand for pharmaceutical advice and prescribing actually and dispensing actually meets the needs of the population. So this document, when it is produced, will be absolutely crucial to how we move forward in terms of commissioning pharmacy services in the future. And I think we start from a perspective of the national conversation amongst pharmaceutical organisations is that we've already got an issue with things being underfunded. So we need to understand what that gap is and then how we need to bridge it to make sure the needs of the population are covered. I think around the question of access, this is quite complex, Sam, and maybe we'll need to give it a bit of thought, because I'm not comfortable with any part of the population only being covered by an online pharmacy service for a whole range of reasons around quality and safety, but also because whether a pharmacy is accessible, what we class as accessible, or whatever that travelling distance is, also is impacted by whether your local pharmacy or the one nearest to you delivers, because the reality is for most people, their GP prescribes and dispenses to a pharmacist, not that someone takes a prescription in there. And then if that can be delivered, you might not be that worried about the fact that it's not a 20-minute walk from your house because your medications are accessible. Where it becomes more of an issue is along the lines of Paul's conversation around if you're actually wanting advice that prevents a GP appointment, then clearly you either want to be able to speak to that person digitally, and for some of our elderly population that is not an option, or you want to be able to see them face to face. So we just need to think through some of those complexities. What would be really helpful for me to understand as a commissioner with a commissioner's hat on is how many of our pharmacies actually have the capability to meet the enhanced specification from the department now around being able to give advice and dispense things that would more routinely have been done by a GP. Because if we haven't got enough coverage that is accessible in that space, then we're not meeting the needs of the community, and more importantly, we're not relieving the pressure of primary care. And that was the sole purpose of enhancing pharmacy services and the scope of what they can offer.
David Northam from Weymouth. I'm conscious of Weymouth being connected to Portland and the issues that are going on in Portland at the moment. So I'm concerned that I think we really do need to do this assessment. It's obviously the sensible thing to do and look at what's the best balances. But there are some immediate issues around Portland with both the pharmacies closing. We have Top Hill and Underhill. That's certainly not a 20-mile drive away from each other, but Weymouth can be 20 minutes away from Portland. People don't recognise that. So can I have some assurance that whilst the assessment's going on, the critical items are still being addressed?
I can give that assurance, Steve. So in Portland, we have a piece of work happening that is a co-production exercise with the community around how they would prefer that their health and care needs are met. And as part of that work, we've been approached by a pharmacy who would like to take over the pharmacy provision for Portland. And we're just having some discussions with them now about what that offer might look like and how can they make sure that it is as accessible as possible to the whole population there. So we have irons in the fire. We just need to progress them to the stage of them being viable for the community.
Thank you.
Can I ask a slightly possibly naive question about the sustainability of the whole sector versus, in terms of delivery, against the additional pressures and responsibilities that are being placed upon the sector? Is there a national picture for how sustainable community delivery is?
I don't feel I'd be qualified to give that assessment. But I think Paul's point and Patricia's is really important. Things are changing quickly, and this assessment needs to evolve to really bring that to the fore. Because when we first did it, I'm thinking back to this new duty in 2013, it was literally more than a geographical list and some maps of the location of pharmacies, their opening hours, some of the public health services that we contract with pharmacies for, but things have changed so quickly since then for all the reasons that we've heard. So I've taken a lot of the suggestions and comments on board. Just before we come to the questions, one of the other recommendations in the paper is have we got the right membership on the steering group? So if the board can have a think about the current members of the steering group, we might need to broaden that steering group precisely because some of the questions have been raised in the room today. We might need to hear from different people about the shape of the PNA as that group evolves to deliver it. So, Paul?
I was only to say on that point, it's really varied because, and it tends to be how close you are to a pharmacy school. Because people train and people have placements in an area and tend to stay in an area, and they tend to not have so much of an issue with pharmacist recruitment, but we don't have that luxury. I think Bath is our nearest one, and so we are, we have to try harder, let's put it that way, in order to attract pharmacists into our county.
A little more than 20 minutes away.
There's more than 20 minutes away from Bath. Yeah.
No matter what car.
Yeah.
Thank you.
Oh, sorry. So I'm Margaret Guy, Vice Chair, Health Watch Dorset. I was just wanted to raise in relation to when we assess need that we need to take into account whether a pharmacist is actually there all the time, because we are aware at Health Watch Dorset of multiple occasions where there's no community pharmacist available on a particular day. So that then impacts on them being able to actually dispense any medicines on that occasion. It happened in Swanage very recently, which is where I live. And also then obviously being able to pick up pharmacy first or the management of minor conditions, which is there's a drive towards shifting people towards a pharmacy for those as well. So I see we're very pleased that we're involved in the steering group as well, so that we can bring what we're hearing on the ground from people across Dorset as well. And the other issue that's become aware of, because University Hospitals Dorset have Boots as their provider, they quite often then are telling people to go to a local branch of Boots to collect their medication. So that was happening in Wareham, for example, but the Wareham Boots branch is now closing. So then you wonder, so what's going to happen to those people who previously were told to go to Wareham to pick up their medication? So there's the complexity here. It's sort of growing, I think.
There are challenges ahead, I feel.
Yes.
Lisa?
Thank you, Chair. Challenges, I think that's absolutely right, but I think also some opportunities. And I guess I was reflecting upon that whole kind of COVID period of time when we had to think about delivery of medications along with everything else. And some of the opportunities that actually came out of that was people saying to us very clearly, I want more of a one-stop shop for how I can get access to all manner of things. And I think the opportunities we've got around some of our locality work, some of our family hubs work, to maybe be thinking more and more creatively around how can people access these things. Absolutely. The 20-minute drive reminds me of the 2-minute pram push walk of where children's centres ended up. And we know that wasn't always the right thing. There's something about if we start with those of greatest need and then think about what would we want to kind of coalesce around that, I suppose. And clearly community pharmacy would be a key part of that. And Paul, I think that would help with employment, because I actually think there's a real issue about people want to work somewhere exciting and somewhere where it's a bit more diverse and they've got a bit more opportunities to be just seeing other community services delivered there as well.
Thank you. We need a proposer and seconder.
I'm happy to propose.
Everybody in agreement?
Sam, just for clarity, can I just check back on the 5 recommendations?
Yes.
So the one that's crucial is, are you happy for us to continue to work on the single pharmacy needs assessment across both health and wellbeing boards? Because a similar paper will go to the BCP Council Health and Wellbeing Board on the 15th of July. So just to make sure we're absolutely clear, that's what we're saying as a board.
I would suggest yes. Yes, we are.
Fantastic. Thank you.
And going forward, in terms of the makeup of the steering group, you'll be in contact outside the meeting for that.
Yeah, I think as we get deeper into the scope of it, we'll remain flexible about who's invited onto that steering group. And obviously, we may uncover some of the issues, particularly around this changing nature of pharmacy service and pharmacy provision. So we'll make sure the steering group reflects that.
And so every member of the board should feel free to make recommendations as well. for consideration. Thank you. Thriving communities. Another long paper, but quite an exciting read, must be said. Well, I'm slightly interested in this myself. Rachel.
Thank you, Chair. I was literally only going to say that this work started as an idea, partly in relation to the work that we did developing the Integrated Care Partnership Strategy. It started as an approach which was aiming not to prescribe solutions. So we had a little bit of money that the Joint Public Health Board agreed to deploy to support community initiatives in both councils. This is the Dorset Council flavour of how that money was used. But rather than diving in and suggesting a whole range of projects and programmes, I'm really pleased with the approach that the programme's taken. And the team are here today to report on the engagement phase. And we've got some discussion about next steps. So I think it's a great piece of work. And I'm going to hand over to Rachel and Dave to take us through.
Thank you. Good afternoon. I'm Rachel Partridge. I'm Deputy Director of Public Health here and presenting, but the lion's share of the great bit of the presentation will come from my colleague. But yes, just to pick up that this time last year, a paper came to the Health and Wellbeing Board, the Dorset Health and Wellbeing Board, with I think it's fair to say a kind of concept written by John and Sam, giving a direction of what we should be looking at and with the proposal for an approach. And then I was given the opportunity to work on that. so the last year, and the first thing I did was get help, because it was very much written in the spirit of how do we develop this as an approach, something that here in Dorset we were keen to do. So right from the outset, we were clear that this was a shared endeavour, this was a shared piece of research, and it was very much kicked off in that way. I was very happy to, and thank you for colleagues for giving their time to be part of this, developing this piece of work. So we worked very closely and we set up a Thriving Communities reference group. Many of you, if you weren't directly involved, very kindly provided some of your colleagues to be part of that group to really shape how this programme and piece of work can develop. So very much modelling the spirit of the themes that were coming through from the Integrated Care Partnership Strategy at the time. So very much building on the three themes and recognising that both Dorset Council and NHS Dorset, plus working with the BCS, all had some priorities that were all in this space. We really wanted to try and get as much alignment and good, decent consideration and representation, and very much align it and build on the findings and the work that was already going on, and then looking to see where the gaps were. So from the outset, this has been a shared piece of work, and I'm really grateful for people's time and energy, not least Dave, but also with colleagues to work on this piece of work. It is quite a detailed report, and it's not the complete report, which is also in an appendix. So the summary paper to the Health and Wellbeing Board, really, the presentation is just going to walk you through some of the highlights of that. I'm really delighted to come back and give a summary of the findings that we've heard very clearly from communities and BCS and individuals across Dorset. So it does feel like a really exciting opportunity to come back to the board to show what we've done today. So George, if you flick on, if you can. So as I say, very much aligned to the Integrated Care Partnership Strategy aims and establishing Thriving Communities reference group to pull together all these different streams of work that we knew that was already going on. So we shamelessly continue to work and develop and use the resources such as the 100 conversations. That was a very powerful piece of work that helped shape our thinking of how do we move on from this. But I think myself and colleagues very quickly recognised that we needed resource to be able to stop, look at the evidence from elsewhere, take stock of the national areas of good practice, and also learn from what's currently happening across Dorset. So we did get some help, and that help came in the form of Dave, will then go on to articulate a bit of the more detail about the work that we've done and some of the key findings before we press you for some decisions about recommendations.
Good afternoon, everybody. My name's David Thorpe. I think I've been put on a pedestal here. And I'm Thriving Communities Partnership Manager. Going to stay on the same slides just for a little while, please. So I will talk you through the process of where we've got, or how we've got to where we are now. But primarily, we wanted the voluntary and community sector to be right at the heart of this. It linked into the principles of working with the sector that the council had worked on, but it also linked directly into the integrated care partnership approach to working with people and communities. And it was a pleasure to work with the sector itself, and you will see and you will hear some of their voice as we go through this presentation. First phase was around some detailed research that was national. I did start looking internationally, but actually felt scaling it to something that was easily adaptable within Dorset was appropriate. We found some brilliant pieces of work, some which were mappable across the Dorset landscape at the moment. And we did engage with local people and did research in relation to our local communities and the groups that serve there. And it's good to say that we found brilliance as well. I'll come on to some of the gaps in a moment and as we go through the key issues, but the gaps weren't necessarily what I expected to find. There were examples of outstanding work in our communities, groups doing really good things. And I'll come on to what they told us in a moment. But one of the areas that came through really strongly, which I don't cover in the key issues, was the complexity of the sector itself. And indeed, when you stand in a sector position in the voluntary and community sector, looking into public services. So part of this project was aimed at simplifying both. Simplifying a way of communicating, understanding, of knowing which groups of the about 3,500, we still don't know exactly because they close down, they start up, but about 3,500 in Dorset Council area. Which ones do you trust? Which ones are resilient? Which ones, if we were to have, goodness forbid, a pandemic, which ones can still stay up because their volunteers are not of an age that they need to look after themselves? So some phenomenal work and leading to, in particular, looking at independently evaluated pieces of work that are mappable. And I'll talk about those a little bit later. Collaborative engagement, I've got a slide, the next slide is collaborative engagement, so I'll cover that then. Did we identify the gaps and risks and opportunities? Yes, but not necessarily the ones we expected to. I'll cover those in the key issues slide. And importantly, the landscape within public service, and I actually come from a different sector, the landscape of programs and projects that are doing great things was such that it was important that this project engaged with other projects. So meeting the transformation team, going to the transformation hub in NHS Dorset, working with adults in Dorset Council to make sure that we were complementing and aligning so that we supported their work rather than perhaps stepping on toes. Next slide, please. So collaborative engagement, working with the voluntary and community sector. Our main partners are what we describe as infrastructure groups or infrastructure support groups. We worked with Community Action Network, we worked with Dorset Community Actions, brilliant relationship with the village halls and community halls, trusted local places. I'll come on to that in a moment. Help and Kindness and Volunteer Centre Dorset. Many of you will know those organisations, work with them, have them in your meetings, and their skills were incredibly helpful in reaching into the community groups and reaching into the communities that we wanted to talk to. As a result of this piece of work, and yes, we borrowed with pride from 100 conversations using some of their material, but some of their methodology as well, we end up talking in detail to 250 people. And that is the work of the voluntary sector groups. So we talked with older people, we talked with the people who volunteer to support them, we talked with the carers, or some of them, we talked with charities, community groups, we went out and talked with GP surgeries, and then a much broader link into local partnerships. As a result, it's social prescribers and service users. Techniques used a variety of techniques depending on the audience. So, for example, when we went to older people, we were very specific about what we wanted to do. So it was with focus groups, really getting into some detail around what they wanted and what they saw the future could be like. Next slide, please. So the key issues, the number one key issue, actually, I briefed Sam on this almost on day one of running this project. When I went out and started talking to community groups, there was a clear message. Do not, and I don't apologise for language, do not helicopter in what you think is the answer, because we probably already know it. So what was clear when we started engaging more was it was about trusted people. It was about those people who knew and had connections and were already in the community doing good work. If you use those people and trust them, then you'll have better engagement, better participation, more older people, in the case of this project, getting involved. Key issue 2 is really similar, actually links to the 20-mile drive that we've talked about, but also links into the transport issues, which came across in every aspect of our engagement, as it does with many others, in that you should use local trusted places, the village halls, the community halls. There are hundreds of them. They're already there. They are being used, but they are fragile. And I will use fragile a number of times as I speak. We want them to remain there because you can walk there. If you are able to walk, you can walk there, you can get there. It's a short distance if they're maintained. Communication, there were 2 issues, main issues around communication. The first one is really around responding in volume or swiftly to key issues. In other words, how do we communicate with a series of trusted groups that support older people in this case? How do we do that swiftly? How do they communicate with us? How do we inform them about changes, about risks? And at the moment, we have a number of infrastructure methods of doing it, but it's not clear. It can be clearer, and that allows you to respond at speed and in volume if you set up a model that works. I talked about brilliance in examples in Dorset. I'm going to quote one in particular, and there I saw a thriving group, a lunch club. I went out to have lunch, and I know Jane was there, Jane Somper, and I saw a thriving group. But not only that, I saw a group being run by passionate people who were planning for the future of their organisation, succession planning in a small group. And in the past, we've struggled in large organisations to be able to do that. But partnership working at that local level was incredible. So you link to the GP surgeries, you have the social prescriber come to your lunch club. Those things that we talk about, that you engage with the parish council, but they went further. They were talking about the taxi drivers. They were talking about the hairdressers. They were talking about the pubs, the schools and the shops. And everybody knew what everybody was doing, and therefore they communicated easily with the older people who worked in or lived in the village. That communication issue will come back to again, because time and time again we were told we struggled to tell people in our area that we're doing good things. It's an advertising issue, a marketing issue. Which leads us on to a fundamental gap that is identified through this, and that is bringing the groups together. So if I have one group working outstandingly and yet 2-3 villages across, they have the same issues, but the lessons learned aren't transferring, aren't being shared because there isn't a mechanism for it. If you can do that and you can bring in good groups and they share their knowledge, they share their practice, if we or others invest in their training, we simplify the bureaucracy, we simplify some of the funding mechanisms, we make it easier for them, and I'm quoting Cornwall, to do what they're good at. You take things out, you allow things to grow at pace. You allow to do more of the health and social care work that they do, but they don't necessarily call it that. Volunteers, it's about the people. Volunteers need to be valued, they need to be trained, they need to be supported, and you need a mechanism to make sure they're doing that. Time and time again, we heard from them, particularly those who were past retirement age, worried about who's going to come along and take over from them, worried about who's going to replace them, worried about the communities they support when they're too old to do what they currently do. Next slide, please. Number one issue for the organisations when the analysis was done by the VCS and by ourselves, funding. It comes up time and time again. There will never be enough money, but it came in from different angles. One was the bureaucracy, the difficulty in obtaining money, the fact that the smaller groups themselves thought they were in competition, and if they're a smaller group, they were less likely to apply for the funding that was available because they thought the bigger groups had more resources to be able to do it. So there's a need to simplify that. The bureaucracy of governing a small charity or a small group is actually quite significant and will be a barrier for some. And then sometimes those people who are funders put in difficult evaluation mechanisms which make it less attractive again and less attractive to apply on the second time and get funding. So simplification is the answer to that, a method by which you can make these things simple. I've touched on the needing to share best practice, so I'll move on. Trusted groups, I touched on this as well. When they're known in the community, their issue around communicating with local people about doing well is far easier. We had a conversation with one group, a dementia group, who do great things, I believe, but they couldn't let people in their community know that they were there because the people diagnosed with dementia they weren't connected to them. And they struggled. They really struggled in terms of their advertising and letting people know they're there. So therefore, the infrastructure foundations at that local level. So infrastructure, I've tried to simplify in my mind in Dorset. We've got the assembly, many of you will know of the Voluntary and Community Sector Assembly, still in its formative stages. I think that's probably describing it about right. Structure seems to be good, but still working to really make the difference it can do. We've then got the infrastructure groups, and I'm not putting layers on top of each other, they're just different. The infrastructure groups, some been there for many years, supporting the smaller groups and charities and larger charities to grow and deliver more service. And then at the local level, the small community group, they probably need a building. They need to be able to advertise. They need to control their finance. They need trustees. They need people to be able to travel to them. There's that infrastructure, and that's where the fragility really comes in. People doing brilliant stuff, but not knowing where the next £200 to £500 are coming from to keep them going. So key issues 11 and 12, I link directly together. And that is, we can create an answer to some of these problems, and it will need to grow and it will need to expand, but that takes time. That takes commitment. But we've seen from programs elsewhere that it really does build a momentum. So I'm going to quote Cornwall again. So when they first started a network hub of older people, and this is not about creating new hubs. This is about where people are already doing good stuff. But they created, and it was linked to the COVID pandemic. They had 30 hubs joined together. They looked at the way in which they funded and they made it simple. And when I first talked in detail to them, the team down there, that had increased to 40 hubs. When I last talked to them, it was looking at 50 hubs. People are coming to them. Groups are coming to them. They're seeing the benefits of it. But that, of course, takes commitment because they need to be supported. So one final slide from me, please. And that, it's in the report. I'm not going to go through that, but this is volunteers, this is chief executives, this is an evaluation report. They touch into the key issues, but it's people telling us about the key issues, it's their words. And if you have time to look through the reports, and indeed those done by the voluntary and community sector, these are in there, but there are many more of them, and they make it real.
Thank you. And I unashamedly added in this slide because I know it went out with the pack, but this felt like it was at the essence of what we were doing and what we were talking about. And as you can hear, there's a lot of commitment, a lot of passion. And in terms of going back to the Thriving Communities Reference Group, which had representatives from across adult social care, the corporate team, NHS Dorset, the engagement team, reps from the Voluntary and Community Assembly, we had what can only be described as a really long, energised, considered discussion about taking all of this evidence that we'd collected, and when I say we'd collected, our voluntary community sector colleagues had collected on our behalf, along with the work that they've done in terms of researching from elsewhere, and also bringing in experience from colleagues who were part of the reference group, so learning from the messages from Altogether Better or from the 100 Conversations, and actually tried to work through. So we've found this out. What do we want to propose? What do we want to do? Is there something here? I've kind of got the sense that everybody was really energised, and absolutely that it felt like this was a good opportunity. So we did go through and look at what potential options there were for us to come and bring as recommendations back to you as the board. And you'll see that there were three options in terms of just collating this, using all the resources and the work that's been done and having it as adding to our evidence base collectively as a system. One other option was about hosting it in-house and doing some kind of network, working with the voluntary community sector, but hosted within one of the statutory organisations, or going for it and taking the opportunity of creating a network using the voluntary and community sector as a model. Lots of discussion, and I think it's fair to say that coming back to this group, it felt like the reference group, so representatives from across the organisations, feel like we're doing a lot of this already, but want to do it more concertedly and more collaboratively and more concertedly. So it feels like an opportunity to explore a vehicle to do that properly. So I was charged to come back and feed back that the recommendation from the reference group was option 3. Obviously, that is a significant, potentially a more significant commitment for us as a system, because the strength of this would be working as a system for the Dorset Place area. There is a bit of funding that still remains in the original funding. We didn't spend it all because we deliberately didn't want to. We thought we'd wait to see what the evidence showed. So, but it would do, it wouldn't be a sustainable funding model, but it's a contribution. So I thought I would be uncharacteristically bold and assertive and put it on a slide as this was the recommendations of the Thriving Communities Reference Group. But
Thank you very
absolutely,
much. Thank you.
the recommendations are there.
Way back, many centuries ago, the young Prince Charles said that his ambition was to help young people help themselves. And you had to write that into every funding application you ever did because it was a quote from Prince Charles. This is about helping the voluntary sector help the voluntary sector. So the principle, I think, carries on and is a really good core thread that goes through what we do. So can we ask for some thoughts and comments, please?
We've got David Taylor online.
We have David Taylor on that, please.
Yeah, thank you very much. A really nice, interesting report about the communities and voluntary sectors get involved. Interesting to see the length and breadth of the county and it's going across. One question for me, though, is the fact is that involving other bodies, i.e., for example, like us councillors, as there are 82 of us, and the parish councils, because the parish councils have a very active role in the communities where they're engaged fully with them, and it would be a very worthwhile thing to bring them involved as well as ourselves, because a lot of us are connected to various other organisations. I'm connected with the NHS company and various other bodies as well, but that's the question to say, have you thought about that? Because that's a very important thing for us to actually realise that after all it's county money being spent on something that we want to go across right in the communities.
Should we respond now? But in brief, absolutely. Recognising that when some of the field work was happening, it was also during the pre-election period for the local election. So it added a layer of complexity, but we did absolutely go out in terms of reaching out to the town and parish councils. And we had elected members sponsor as part of this journey, and obviously very willing to have elected member involvement. Absolutely.
It would be a really good way of linking local councillors in with local councils and local charities and voluntary sector, and not even registered charities, but local people who just do stuff. It's really exciting. Another question, please.
Thank you.
Patricia's online.
Patricia.
So my answer's quite long, I'm afraid. Let me turn the fan off so it doesn't interfere with the noise. So in terms of the issues that have been raised, first thing is I'd really like to just take this paper to our ICB board, just so they are cognizant of the work that's been done in this place, and we're not just talking about health. I think that the coordination of the VCSE activity network is what the Assembly is all about. So we need to think about how we support the Assembly to get into a forward-thinking space more quickly, so that they can fulfil their role around that, because most of those organisations belong to the Assembly. We need to think about how we help them coordinate their activity and provide the support to different networks that they're supposed to be doing. In terms of increasing our volunteer cohort and making sure that young people are volunteering, our NHS providers have a young volunteer programme that was started nationally, and it's been really successful. And I know that there's something similar in local government, but I do think there's something around how we approach our schools in terms of helping them in their role of defining what good citizenship is, and supporting them with some of the materials that mean that they're having a much broader conversation around citizenship and how you become a valuable member of your community. I think when we think about item 7, which is around the bureaucracy, we do tend to try and make the third sector retrofit the way it operates from an administrative perspective to align with what we want, as opposed to thinking through carefully how we can make the bureaucratic process as simple as possible. And that may mean that, that maybe Sam and the ICB need to think a bit more carefully about developing a common approach to contracting and evaluation that makes things simpler, but doesn't move us away from the fact that we absolutely still need to see value for money. We we have just finished developing an infrastructure strategy for our health organisations, and the next step is to come and talk to the broader partnership. So what we're actually putting on paper is a one public estate infrastructure strategy, so that we're all clear what we need to do in that space of capital and revenue to support the delivery of the ICP strategy. And we're starting to use our estate more flexibly in order to deliver that. And as part of that work, we're going to do a piece of due diligence on separating elements of the infrastructure strategy so we can clearly see what is available to support the out-of-hospital model. And that is much broader than just health and care. It's the work of the integrated neighbourhood teams that are currently in development. And that would include offering the VCSE sector opportunities to use one public estate to operate out of in order to be able to deliver what's required around that broader conversation for integrated teams around thriving communities. So I suppose where my head is right now is sort of feel like this has come here first, when maybe it should have gone to the place leadership team for Dorset first to say, this is actually core work for you. Can we talk about how you might want to propose to the Health and Wellbeing Board, how you might execute that work? It links really closely to the following paper on social mobility, and also that we have just launched the work last week on the integrated neighbourhood teams, of which there are likely to be 20. But the way I see the work of those teams is much broader than health and social care. It is supporting communities in those neighbourhoods to thrive, and that also means using the extended roles that primary care has around social prescribing to also to be able to signpost individuals to the third sector if they need it, debt management if they need it, housing support if they need it, employment support if they need it. Because unless those teams have to take that holistic view of people that they come into contact with, we're only ever going to see them as the disease that they present with, and not that they've got a whole set of life issues that might be contributing to them not being able to achieve good health and well-being. So whilst we're concentrating at the moment on mobilising those teams around only health and social care, in the next sort of 2 years, I actually see, in my mind, their role being much broader than that, and it is about supporting communities to thrive.
It seems to me that these things are coming to a head at just the right time across multiple. And I really welcome the opportunities to develop this in partnership, which is wonderful, and what we're all here to do. Jill Taylor.
Sorry, I just wanted to come in. As you're all aware, we're in a new administration and we're just finding our feet. But one of the things we had down as one of our manifesto pledges was around working with area boards. And it seems to me that this sort of thing sits really well with them, because we're very much on taking decisions and actions down to the local communities and working through a board type system, an area board. It's obviously, we're only a month in, so we're miles away from having these sort of things set up. But those to me are where this sort of work fits. That's just social mobility, which fits at councillor level, at parish level particularly. And certainly, I mean, the voluntary communities really need the support out there that has been talked about today. So I very much welcome this report. I think it's an excellent report, and look forward to seeing the iterations of it. Thank you.
Thank you. I think, Councillor Deacon, you've been waiting for a long time.
Oh, hi everyone. I think that was me. It's Alice Deacon, Corporate Director for Commissioning and Partnerships. Just a real opportunity here to connect up some of the things in relation to community around the work that is now really well embedded across children's in terms of the local alliance groups, which really brings together that local embodiment of our strategic alliance, the partners across health, police, and schools into the local community, and where our voluntary and community sector partners, as well as parent carer councils and others, are there really thinking about the priorities for children and families. We've also been able to release funding into those local alliance groups, so really quick application, quick access to resource for small community groups, parent-led projects, you name it, there's an opportunity to do it through that. And also a real opportunity here to think about how we connect with them. You know, the work of the family hubs is really well progressed now. We're seeing kind of that all-age community setting being developed, especially with Swanage and that community asset transfer, and thinking about those opportunities and also the network points to really grow this piece of work. So there's lots to shine through and to build on in terms of how we connect our communities, and we're seeing fantastic projects spring up from that work, including the Pineapple Project and other aspects that really take on board the voice of that community and think about how we can take it forward. So a real opportunity here for us to build on some of the things that are already in train, and really welcome the opportunity to work across with you all on that.
Thank you. Sorry, Alice, I got your title wrong. I thought you were a councillor. Maybe one day in your wildest dreams.
Stay away.
What I would add, actually, going back to a point earlier around kind of locally elected members, the LAGs, we are absolutely honoured to have some of our locally elected members as chairs. We've also got town councils in those spaces, so it's just absolutely who you need in the room. So there's so much to build on in that space. We really welcome the opportunity to work collectively there.
Indeed. Thanks, Simon.
Yeah, so Simon will really welcome this interim report. I thought the key issues were a great problem statement. And I think it's set out very neatly. I do think that it's very hard for the voluntary sector and communities to prove the social value of what they do. We all can say, we all nod and we all say, yes, they add a huge amount of value. When you try and put it down on a spreadsheet, it all comes down to resources and funding at the end of the day. It's much harder to articulate. So if that process can be made a little bit simpler, great. I also really picked up on the word fragility that you mentioned. Community groups do come and go, and they particularly come and go when funding's turned on, turned off, flavour of the month changes, things like that. So consistency is really important to community groups, because they get into the fingers and toes of that community and can do a little good. But having some longevity about what they're doing really helps. And I particularly picked up also on what Councillor Jill Taylor said about your manifesto pledge to develop it to a local level. And all I could say is, I really do think that the biggest benefit comes when these things are decided and agreed at a local level, because communities know what works for them, and every community is different. So that was really nice to hear, and thank you.
You're laying the foundations for my discussions at Cabinet. Thank you so much. Is that everybody? Because we need to. Can we get Amanda?
Okay, don't you forget to come to me though.
Thank you, Councillor Jones. Thank you. And thank you, George and Chair. Just to come in on that point really about our fabulous children, young people and their opportunities to become helpful. And they've described this to us. So the great work of our Dorset Education Board, which seeks to think about all the educational experiences our children, young people can have in our place. Our children, young people wrote a student pledge with us. So we listened deeply to what they said as an education board. And number one on our pledge to them is helping children, young people gain the feeling and skill of helpfulness and purpose. And many of our children, young people are very helpful and want to be. And I was just reflecting on when my little girl got the helpfulness cup at school and what that meant to her to be helpful. So thank you for Patricia for that gift of saying our young people want to be helpful. You're absolutely right, they really do. So again, alongside Alice, through our local alliance groups, through this work, really happy to connect our young people in who are just already being really helpful, but actually perhaps we could magnify and expand some of that work together.
Possibly a last word,
Not that short though. I come at this from a few angles. First of all, I do chair the North Dorset LAG, and I also set up and lead on the Vale Pantry, where we help at any one time just over 1,000 people throughout North Dorset. And how we've actually evolved. We started initially just with food during the pandemic, but it's evolved and grown so that we now do a whole host of things. And we're moving to larger premises later this year, and we're part of the Family Hub network and so on. But I think that your option 3 is definitely right, that it should be a VCS-led, chaired and led setup. And we have to make sure that the people we're working with, they feel like we're working with and we're not doing to. Yes. And that's just really important. On the issue of funding, it's a bloody dog-eat-dog world out there, and funds are tight. I mean, I write funding bids all the time, and I have to raise about 300,000 a year to do what we do, which I do, but it's such a job. I think that we're now going into an area of working with older people, which will include lunch clubs. It will include bike rides out on a tricycle, a trike going up and down through the town, and all the rest of it. It will include hospital discharges, which we're doing already. But in order to do some of this work properly, really, the funding model needs to be 3 to 5 years, because otherwise you can't take on this. If you need to take on an extra member of staff, can you really risk it for a 12-month? You know, it's a real problem, and you want to get the right people. And I think that in terms of area boards, I mean, I wonder whether we could look at the LAG model, because that model is already there in each of our areas. They're very good, they're very well attended, and we have such a good cohort of a mix of voluntary bodies, statutory bodies, everybody from schools to health workers to Dorset Council, to everybody is on that. Maybe there is an avenue to expand from that. I don't see why not. I just worry about setting up what could be seen as another layer of bureaucracy. And I mean, we're already talking about integrated neighbourhood, whatever they're called, partnerships. It's just understanding how we don't want to. Let's keep it simple. Keep it simple, and it's got to be wraparound. It's got to be holistic. And I think that I'm quite excited about what you've done. What hasn't come over in the report clearly is talking to some of the older people that you did, where they feel, what did they actually want? Do they want their shopping done? Do they want their dog walk? Do they want their prescription? It's trying to actually just sort of bring in what people want, and that may well be different in different areas, but it's actually it's delving down into what the community actually needs. And I think that the town and parish councils could do more, and they don't do enough in terms of advertising everybody that does great work in their community and where they can go, whether it's the Scouts or the swimming club or whatever. And perhaps there could be a lead from Dorset Council to ensure that every town or parish actually delivers something that can go out to the whole of their community. This is what's on in your area, and putting people together. I think I've covered it all now. All the key issues, very good, lovely, thank you very much. And the other thing really is that what I think has been missing in the past, and I'm coming at this with the view of hospital discharges here really, is that there seem to be a number of bodies that commission people to go and do something. And none of these commissioning people actually get out on the ground and do it. But the people that do get out on the ground to do it, people like the Vale Pantry, we'll go out and we'll spend 30, 40, 50 pounds on buying incontinence pads, in buying sort of batteries so the gentleman can have a shave. And all of these things cost money, and the funding has to be at grassroots. We've got to really rethink about what we're spending on commissioning and who's actually delivering it at a ground level, because it's a job raising the money to do it, and the volunteers use their petrol and so on, and that money needs to be delivered at a ground level and not so much at the commissioning level. Thank you. I'm out now.
Thank you very much. I think you sense the passion around the room, and I think we could possibly carry on for another hour, but let's not. The proposals and recommendations are in front of us, and we'll talk about a sponsor just in a moment. But can I ask for a formal proposer?
I don't know if Patricia wants to come.
Oh, Patricia, did you have your hand up?
I just wanted to make a couple of points because, first of all, I don't want us to get into the habit of talking badly about each other. Commissioning teams work really hard. Yes, some of their job is to understand the need, but actually the majority of their job is to make sure the need is serviced. And if there's a different way of doing that, which we're talking about now in the ICB and the council, because we need to use and fund the voluntary sector in a different way, then we're absolutely in that place of wanting to do that. It's really difficult to, as it is not just for us, but for you as a local authority, it's really difficult to agree long-term funding arrangements, because the reality is that's not how we're funded as public sector organisations. It's not how our budgets work. So again, it's don't shoot the messenger, because we have to work within a legal framework that is set down by government. What we can do jointly is think about joint commissioning approaches to some of this, and we can take some risks around pre-commitments to ongoing funding in the future. But we have to understand together that if we do that, there are risks with doing that, because the funding envelope might change the year after. So there's something about the level of risk that we're prepared to take. The integrated neighbourhood teams are not, just to be clear, they are a delivery mechanism. That's why, and they are mandated through the Department of Health. But it's the community that we're engaging with that say, actually, can we just have somebody that signposts us to everything that's impacting on our health, not just dealing with our health and care needs? And the community are represented on the design of how those neighbourhood teams work, because they have to work and serve the needs of the community. My final point would be that in the ICB, we have something called the Inward Investment Team. They are expert individuals at putting bids together in order to attract money from outside of the normal public sector routes through government. If Dorset Council would be happy to contribute something to that team in order for us to expand it, we would be more than happy to offer that as a service to the third sector for that team to put bids together on their behalf, and then make sure that they are fit for purpose, so that what they're not spending time doing is the bureaucracy of the process, when we have got a team that have got the skills to be able to do that very quickly.
Thank you, Patricia. I think that's a very generous offer, and I think we need to find a way to respond. I think this is about, well, every local charity has its own frustrations, and every local charity has its own mission. And it's only right that we recognise and value the mission and values that the charity has, rather than template what we want over the top. And I think, again, this is about partnerships and working together. So I welcome going forwards. So can we have a proposer, please? John, and seconder. I will happily second.
Can I just confirm that's in to recommend
items 1, 2, 3 and 4
of option 3 as well?
Yes, that's what we discussed, option 3. The item 4 to agree a health and wellbeing member to sponsor to oversee the next phase of the project. Is there anyone that would put their hand up for that, or can I have it? But I don't want to just jump in and take over. It's phenomenally exciting, and it's something that actually we need to engage with people who are not members of the board as well. I'm looking at you, Carol. So I would, would everyone be happy for me to take that forward? Okay, anybody against on any of the proposals? Thank you very much. Okay, we're running a little behind, but actually I really enjoyed that. I think we all did, because sometimes it's so nice to engage with the positives and the future. Improving social mobility in Dorset. Sarah.
Thank you. I think Claire's just going to start us off.
No, that's fine, Alice. You go first, but I'll make a few remarks before we go into discussion, if that's okay, Steve.
Yes, of course.
Thank you. There's just a slide just to set the scene. Thank you. I'm Sarah Crabb. I'm a Commissioner in Children's Services. I have the lead there for social mobility. I trust you've all read the reports.
And I note that we're running behind, so I'll keep it short. It's just a bit of data to flash up in a minute, just to explain where we are in Dorset at the moment with social mobility. And depending on what data sets we use, we get a slightly different picture. But generally speaking, we know that social mobility has been an issue in Dorset for generations, particularly across the South Dorset area, Weymouth and Portland, and also out towards Swanage. Thank you. I wanted to highlight this because we can see at the bottom right there that back in 2018, we were planted firmly at the bottom of the table. There we go, South Dorset right at the bottom there for the worst performance, social mobility. And down the left, when we look at specific indicators under the indices of multiple deprivation, we can see that we've got 11 local communities that fall within the lowest quintile for that. And then when we look at, for example, educational deprivation, we've got 25 communities experiencing that. And then when we bring in housing, affordability and security, and also rural deprivation, access to services, we can see 66 communities are experiencing that type of deprivation. So it's a mixed picture, and it's one that's not being I feel accurately reflected in the latest Social Mobility Commission's State of the Nation 2023. They've moved to a different way of reporting. Our data has been merged with that of BCP and Somerset. And we can see there that actually we're kind of in the blue. And that's really masking some of the specific challenges that our communities face. And so part of the recommendation here is about better use of our data to really understand and respond to our local communities' needs. I'll pass it over to Claire, I think, to take us forward.
Yeah, thank you, Sarah. That's great. I mean, as you say, I'm sure everyone's read the report, so I'm not going to labour it too heavily. Just very quickly, a personal point. I actually grew up in Weymouth, and I left when I was 20 and came back when I was 40 to bring up my children. So that's my own personal social mobility story, and it looks like my children are about to do the same. So in this particular part of Dorset, I know the communities very well where this is the greatest issue. Sarah's highlighted some of the issues with the data. The amalgamation of some of the data really hasn't helped us, but we absolutely know where the concentrations of income deprivation, multiple deprivation, etc., are within our county. The failure of the Stronger Neighbourhoods initiative to get to grips with this is really regrettable. So, to be honest, so I really welcome us having another go at this. I think the main threads that that Sarah's picked out in her report: early years, education, employment and skills, housing, are absolutely the right ones. I welcome the inclusion of green spaces and outdoor, particularly as a green councillor, as I would. Also, the recognition that our commissioning has not always made it easy to involve small voluntary sector organisations and charities, and that I've had some experience of that myself in my personal life. So I can't really recommend this more highly. Across directorate, multi-agency approach seems the only way we're actually going to make inroads into what is such an extraordinarily significant issue, particularly in Weymouth and Portland, as is what the data is telling us. So I'll leave it there. Thanks.
Thank you. Should I just recap the recommendations so you don't need to all pull the report up again? That across directorate, a multi-agency task force is established to look at this issue of social mobility, look through our work with that lens and just ensure that there aren't gaps in provision. We know 2021 there were recommendations made and some of those have stalled. So really just creating the structure within which we can, thank you Liz, receive new policy, including recommendations from the Social Mobility Commission, just work together, all this brilliant work we've heard about today, pull the threads together and report on social mobility annually, whether that's to this committee or elsewhere. Thank you.
Thank you very much. Thoughts, comments?
Could I kick off? It's David Northam from Weymouth. I'm not a member of this board for people listening. I'm just here because I'm a councillor and interested in this. I really welcome this recommendation to Cabinet. I've got a few comments on the details. I'd like to raise the level and scope of the recommendations because I think it needs a boost. I was pleased when Councillor Pete Barrow put the motion to council back in November 2019 on social mobility, and it was accepted. Sadly, as Claire Sutton has said, it didn't, the stronger neighbourhoods which emerged didn't really make significant progress and was stopped. It was stopped for a variety of reasons. There's a very good report which tells you those reasons, and we must make sure we look at those reasons when we move forward. Sarah's pointed to data. We both like data, and data can be very misleading. And the situation was, so South Dorset 533rd of all parliamentary areas in UK. That is shameful. And I'm going to also say that I think, and I might got my number slightly wrong, Weymouth and Portland Borough Council came 322nd out of 324. It was in that ballpark. It was third bottom, I think. And that's shameful as well. And this dates back to 2015. It was indicated back in 2011. And it's really time we did something. And I welcome what's recommended. I think more needs to be done. Just picking up, if I may, because when the stronger neighbourhoods kicked off, it misidentified the areas. I wouldn't want that to happen again. And there were 11 areas in the index of multiple deprivation in Dorset that are in the bottom 20%. 10 of them are in Weymouth and Portland. In Melbourne Regis alone, there are 3 areas. There's the Park District, the Town Centre, and, sorry, the Town Centre is in the bottom 3%, the Park District is in the bottom 5%, and the Carlton Road area is in the bottom 12%. This is shameful. And that's, each of these LSOAs represents about 1,500 people. I don't know the numbers. Well, the numbers are in the spreadsheet, but it's that sort of number. So it's a significant number of people within those areas. It's a concentration. The Malcolm Board was set up and sadly declined and went nowhere. So attempts have been made to do something about this. And I'd like the report to actually reflect in a little bit more detail where these areas are, and not talk about 9 areas, but talk about the 11 areas. You made the point that there's different ways of measuring, but I think the fact that people tend to think of Malcolm Regis and then they think of Bridport Skilling area as if they're similar sized. Well, that's a third of that one. So we need to bring it out in detail. Otherwise we lose sight of where it can do most good. There are a number of things. So that is actually repeated, the principle of hiding data by acting up. Dorset Council hides the data. We missed out on levelling up funding in round 1 because the data had been aggregated. Our MP, after being pressed, did go back and ask for a change to the rules, and there was a slight change to the rules, and we managed to secure some funding, but we only moved from priority 3 to priority 2. So we were never really going to feature that strongly compared with other areas. So we need to be very conscious about how this data is reported, and we need to have it up front. Hiding behind Dorset Council averages, which is the top right, I think gives us a feeling that most people in Dorset are really doing all right, but there are some who aren't, and we need to be looking at that as well. I've got a number of detailed comments, and I could go on. Perhaps it's best to feed these across, but the Dorset Echo recently reported the school's performance, and you note that the 4 schools that are at the bottom of the pile are in Portland and 3 in Weymouth. What I'd like to talk about is big ticket items. Again, Levelling Up Fund is a marvellous opportunity to do something. There'll be something like that in the future. We don't know what it is, but we ought to get ready. And because most of what Sarah recommends is already covered, and it says in the report, is already covered by what's going on. But what are we going to do that's not sticking plaster? And this goes beyond sticking plaster, but it's very graduated. How do we make that big impact? We can't do it within Dorset Council within our funding, but we could do it with government funding. So we need some big ticket items. And I suggest we try and form a set of big ticket items. I have a personal one which I'll put on the table just to give a flavour. Melcombe Regis used to have 3 schools. Well, Weymouth and Melcombe Regis in the town centre used to have 3 schools. It has none now. They've all been shut down and the provision has been moved out of the town centre. So the kids who are worst off have to go the furthest to schools. It's worse than that because the nearest schools are oversubscribed. So they have to go to the next level of schools. So Radipole School, which is next to me, has the biggest catchment area in the whole of Weymouth because it's got 2 form entry. So a school in the town centre would make a huge difference. There's lots of research which shows that a school can be the heart of a community, and it's where community will coalesce and actually drive change through the community. And it's a big ticket item. We couldn't fund it ourselves, but with help. And if we can't fund a school, then perhaps an infant school. If not an infant school, expand the early years provision. There are ways that I think we can get to that. But big ticket items, I think, are really important for us. And then looking more rurally, buses cost an awful lot, so it better be down as a big ticket item because it's not really going to be. It's going to be very difficult.
There's probably a scoping exercise that we all need to do.
Yes.
Because there will be many big ticket items that different councillors will bring for different needs, and that possibly links with the other aspect of the things that we talked about. It can just before I bring Patricia in, Teresa, did you have a response to that?
Yeah, thank you. So I absolutely welcome the ambition, and I think the purpose of bringing this paper today is it's been something that we picked up within our Children and Young People's Plan for the 10-year plan of 2023 to 2033, because the whole of the partnership were absolutely committed to saying that we wanted to see the eradication of child poverty in particular, but also the issues around social mobility, which have been so stuck for some time. We know that many of the social mobility indicators that lead to those sorts of statistical outcomes, whether we like the ones we're seeing or not, are living in children's lives, not uniquely though. So loneliness in older people is a social mobility indicator too. So it's another good example of how when we work across that intergenerational space effectively, we'd have impact. I won't remind us that we're not allowed to open schools, but we are allowed to think about how and where we work with those schools. And clearly, even as I've said before, where the academies that are the lowest performing, we are disinterested at one level at their academy and we continue to work with them, and the Chesel Challenge and other things have been going on to really drive up some of those standards. The Maths for Girls Challenge. We know to a very small population where our deprivation and disadvantage gap is in education. And that work is underway and beginning, but we need the strength of the whole of the body of the partnership to really be doing that. So part of the reason for bringing that here, which is it's a subset of what's already the Strategic Alliance Plan, which this board oversees, but we really wanted to pull this out, highlight it, have it as a provocation to make sure that we are grasping something which we'd heard from lots of people wanted to be kind of on the table, really. So I appreciate it'll be a lively debate and look forward to it.
Thank you. Which possibly leads us nicely into Patricia.
Thank you. So you're probably going to get sick of me saying this, but I'm really conscious of the fact that, well, I absolutely agree that this work is important, but again, I'm not seeing how it links into the work of the system. And the reason why I keep repeating that is because Wes Streeting is likely to be the Health and Social Care Secretary next week. And he's really clear on the delivery mechanism for communities is through integrated care systems. So we need to be really clear on how everything that we agree in this board links into the work of the ICP, accepting that there will still be organisations around the table who have statutory obligations that need to be fulfilled. Round that table are all of the partners that are needed in order to move this work on in Dorset and BCP. And one of the 3 priority areas that that broader group has agreed, which has local authority representation on it, is that social mobility is a key driver and that needs to be addressed, and we need to have a plan to deliver on it. The second thing in my head is this also connects into the Thriving Communities conversation, because yes, social mobility starts with children, but actually we can do a lot in the space of adults that are currently in Dorset as well. And so I think we need to think a bit more broadly about it than we are in this paper. And the LEP, at the request of the ICP, has recently done a piece of work on its draft economic strategy, and that was aimed at trying to understand what it actually costs to live in parts of Dorset and what would we need as a minimum living wage in Dorset to be able to live a reasonable standard of living at the bottom end of the income scale, because we haven't even got that in some areas. And that work shows that we, at December 2023, across the whole of Dorset and Bournemouth and Poole, we had 95,000 people between 16 and 64 that were either unemployed or economically inactive. And it also shows that by the time, in 2023, 38% of all of our economically active people were aged over 50. So this idea of social mobility is incredibly important, because if not, regardless of the fact we might change the model of delivery of health, social care, domiciliary care, supporting independence, if we don't address the social mobility issue, we're not going to have the people within our community and workforce of working age to be able to look after our elderly. So it's a really important piece of work, but I think we're seeing it through a lens that is too narrow, and we need to think about it on a broader footing of all of our communities that are working age. How do we enable them to be more socially mobile, but also in the context of, as a consequence of that, how do we move from being a low wage economy to something more different, where our young people are ambitious and want to stay and optimistic because they see a bright future, and that they stay in Dorset, not that we're creating social mobility for them to leave, because that will not solve our workforce issue, particularly within public service.
Thank you for that. I think we would, as the local council, be very eager to work with you to put a joint proposal to the ICB so that we can make sure there's harmony through all the strands of work that we do. With a really good partnership going forward.
Sorry, I know we always talk in rooms such as this about deprivation in Portland and Weymouth, and I get that, but I just really want to point out that we must bring in areas such as North Dorset, where the transport infrastructure is so poor. If you live in Sturminster Newton, all you've got, for example, is an expensive, very small co-op. So getting to the cheapest supermarkets is a real problem. And I would really quite like to see a little bit more work drilling down to North Dorset or the different areas of Dorset to say, well, people in our town, for example, and Stallbridge, they've got a 20, 25, 30 mile round trip easily to get to a big supermarket. And that causes problems in terms of food deprivation. So it's not, there are different levels of deprivation, and I would say a lack of transport is a huge issue in a very rural area.
Yeah, and one of the things I think that I'm a bit of a data geek myself is that a lot of the things we're talking about are sort of like addressing critical and acute need, and we need to be moving towards preventative as well. So any data that we can now start gathering that will identify where future potential issues will be, so we can actually develop preventative approaches, will be hopefully a part of this process as well.
So do you know where the figures are of the economically inactive people? You've got them there. Fab.
I'll send it to you.
Oh, thank you. Let's have a look here.
So the data is there, but it does take a lot of digging. And the actual what are the boards that you can put up called? I've lost the name of it. The
business intelligence.
Business intelligence dashboards. That was the word I was looking for. The dashboards, if you dig into the data and get you to it, I've got on an Excel spreadsheet. And Dorset is very unequal. East Dorset, for example, has 20 areas in the top 10% on the index of multiple deprivation. That means the least deprived. Whereas, it has none below 40%. And similarly, in North Dorset, it has none below 40%. So it isn't equal, and the problems are different. There are rural problems and there are urban problems, and they need slightly different treatments. And Patricia's very well said, and I agree with her, that we need to be clearer on the problems we're trying to solve, link the actions and the outcome. I wrote it down. And she brought in the LEP, and I'm only a newcomer, so I'm going to speak on the basis of my experience, which is that the LEP has done very little for most of Dorset. It's done a lot for the area around Bournemouth, Christchurch and Poole, but very little in this part. And the easy pickings have been around the airport and around the university. That's where things can spin off very quickly. It takes more effort to do more. So the LEP is dying, and Dorset Council is picking up the responsibility. Not quite clear to me yet how, but I'd certainly recommend more involvement with the Dorset Chamber of Commerce, who are quite a strong group with employees who can help some of this direction. And I'm going to try and find out where what the latest draft economic strategy says, because if it says our area should focus on tourism, I will be very cross. Tourism occupies a very important group of people, but it's not going to change the economic climate for Dorset. We've got to look bigger than that. So that's one of the recommendations I'd like to add to the recommendations, that we bring in the economic growth more strongly, and we look to Dorset Chamber of Commerce to help us with that, because they understand us. I don't think LEP does.
Okay. Sam.
Sorry, strong statement.
Thank you, Chair. This is a really important conversation. I'm glad we've had it, and I just wanted to offer a couple of suggestions, not necessarily as DPH, but as my role in helping develop the ICP strategy, because I think there's lots of space and there's lots of room for work on social mobility. It doesn't have to compete, and in a way, this is a really, really good example of what system working should be about, which is coordinated action at different levels, which involves the whole power of all of our organisations working in a way that can be coordinated right at the top level through issues in the ICP strategy, but it shouldn't negate individual organisations taking these really important issues forward through things like the corporate plan, for example, in Dorset Council, which we're going to be thinking about and working with members to understand, what we should be pushing forward on, and where we need to be working together as organisations, statutory organisations, people-owned communities. What are those really key top-level strategic priorities, which alludes to Patricia's point about making sure we've got a real focus on this as a system, and we're clear what each partner's role and responsibility is in some of the work. So I think it's a real opportunity to start to have a good conversation about what we can all be doing at some different levels. The all age thing, I think, is really important, because if you look at the trends that are coming down the track, our population is not getting healthier. It's having a real impact on growth as a country. There are fewer people that are able to stay in work for as long, and it's affecting productivity. So we do need to be having these conversations. So just a reminder that if we can think about this through the lens of that integrated care partnership strategy, which is at sort of top level, but all of those opportunities for our individual organisations and even our conversations in neighbourhoods about how we tackle some of these issues will be on a much stronger footing, I think, going forwards.
Lovely. Thank you very much. So we've reviewed the report and make the recommendation that was heard before. Could we have a proposer for that?
Could I make
just very quickly?
Very quickly. So in Pete Barrow's original proposal, he included in his recommendations appoint a cabinet lead member and a local director, a lead executive director, to report progress regularly to full council. Now, if we pull that up to an integrated care partnership as a way of achieving that, I do think it needs to be on our agenda. And I think in the same way that we address all actions in a climate emergency viewpoint, and we've got the climate emergency action test list, I think we should have something that addresses this for all our actions, because I do believe we don't have it in front of us. It's too easy to deal with the easy and not the difficult.
Thank you. Yeah. You get agreement from the executive?
Good.
Thank you. Good way forward. So can I have a proposal, please?
Just to confirm, this would be a recommendation for Cabinet.
A recommendation to Cabinet.
Yeah.
Okay, yeah. Thank you.
I'm sorry, I'm a little unclear. Have we incorporated Councillor Northam's suggestion? We haven't, have we?
Yes, we have.
We have.
I think we have. Okay, if we move that, can we have a sub vote then? Shall we to include Councillor Northam's proposal as one of the recommendations? Can I have anybody against?
I'm a little bit concerned about this because while it probably sounds like a good idea, you know, a suggestion to a recommendation that we've all read and studied over a period of days and looked at in detail, and then a suggestion comes forward literally 30 seconds before we vote on the recommendation feels a little bit hasty to me, to be honest. So I'm not saying it's a bad idea, but I just don't think that's the way to make decisions. Actually, I think we should go with the recommendation and maybe then return to that conversation.
David, do you have a response?
I'm not a member of the committee. I do have a response, but I think the committee needs to.
Fair enough then, George.
Could I just make a point on procedure? So this would be going to Cabinet for a decision by Cabinet. The board isn't making any decisions today on whether to implement this. So if the board is minded to agree with the suggestion from Councillor Northam, then it would be for Cabinet to decide whether that would be appropriate to implement. I think the same principle still applies, that us making a decision at the last 30 seconds of a meeting isn't a good one. But I do think that the Cabinet should consider that. But I wonder if we should get that onto the agenda when the Cabinet considers this via a different route. It's just the protocol of decision making. I just don't feel comfortable with it. I know that sounds a bit bureaucratic, but yeah.
Okay, I do appreciate that, Claire. What I would suggest is that the recommendation goes forward as written, and that we agree that. But this meeting also notes the comments that David said, whether it goes forward to Cabinet, and that way we've got a clear line of decision. But we've noted the comments that have been made, but it hasn't actually been decided. Would you be comfortable with that?
I think that sounds very wise, and I'm happy to propose thus.
Can I have a seconder? I will second it then. Anybody against? We are three. Thank you very much. Thanks, George. Thank you for that. Thank you, Claire. Item number 13, Safeguarding Families Together evaluation. Lisa.
Yeah, just quickly. Likewise, I'm very new to this, so I'm really delighted that Lisa's done all this fantastic work into this and is going to present. But I'd like to say a few words once she's done. Thanks.
Thank you.
Thank you, Councillor Sutton. Okay, so hello, I'm Lisa Reid. I'm Corporate Director for Quality Assurance and Safeguarding Partnerships. In the paper pack, we've provided an assessment, a report update to an evaluation that was undertaken in relation to our Safeguarding Families Together pilot. So we've provided that report alongside the full evaluation as well. And I've just got a couple of slides to highlight some of the key points and to be clear about what is being asked of the board today. Thank you. So in terms of the recommendation, as I've just said, we have shared the evaluation report, and I'll explain just a little bit more about Safeguarding Families Together in a second. And what we're asking today is for consideration of what the partnership commitment is for the wider rollout of this initiative, and any further possible expansion, which could include our care leaving service. So recognising some additional benefits that could be given to across wider access to services for care leavers particularly, and for consideration of the partnership commitment could also include possibly a review of the commissioning arrangements and a different way of working in line with the Safeguarding Families Together model. The reason for this recommendation is to allow full consideration of the wider benefits of SFT, which is clearly stated in the evaluation, and how that's improved outcomes for our children and young people, and how as a partnership that can go further, and particularly thinking about the benefits for the wider partnership. We would like for the board to advise how the partnership wishes to proceed post March 25, if they would like to give a view on that. We have got funding currently to provide this up until March 2025, but not beyond. So Safeguarding Families Together really incorporates that co-location of our adult practitioners supporting our children and young people alongside their parents and carers who may be requiring support for mental health, domestic abuse, substance misuse. And what we've seen within the evaluation is the impact of exactly that model, and particularly as that focuses on a approach where we go out directly to our families and work alongside building those relationships, and understanding that actually sometimes things can be difficult for our families, and on first trying to gain access and provide support might not always be successful. And actually what we do is we keep going out to the places and the spaces that are suitable to them to really be able to build that relationship and provide the support that they need. So the model of Safeguarding Families Together is really about not waiting for referrals, not having that kind of bureaucratic system that holds access to services, but actually being much more alongside the family at the time when they need it most. So in terms of the evaluation, we have successfully worked with 127 families, which includes 148 children. And so far we have already successfully closed, which means we've reduced the level of risk and need to those families for 37 children. You'll see in the evaluation that talks a lot about the new kind of shared value-based language across professional groups and with families. It talks about the improved information sharing and understanding across that professional discipline, and being able to work collectively together to make the best outcomes and decisions for that family as a whole. It does talk about opportunities to expand geographically and towards a wider partnership. So that is part of the recommendation. We want to roll this out to all of our localities, and thinking about other places in which we could expand, as I referred to, in relation to care leavers. And you'll see there's some incredible comments that we've had, and this is just a very small fraction of the feedback that we had from our families and the impact that's described in that evaluation. But it has really made a significant difference to the outcomes for those families, and have really welcomed that level of intervention and support, and have found it incredibly supportive and very much done with. So in terms of the next steps and considerations, I've just highlighted some of the financial position, which I think, George, you might have on the last slide, which sets out the contributions that is required to deliver against each of those adult practitioners. So for this financial year, we had some small contributions from our public health colleagues, and we are looking for just over 1.6 to be able to roll that out to the wider localities for the following year. We have, as part of our evaluation, talked about some of the impact for partners, and particularly this particular model is very well evaluated by other local authorities and as well. So we've put some information there around Hertfordshire, and we are going to be working with partners to think about how we evidence some of the wider impact that it's had for our partnership as well. So as Councillor Sutton said, I'm happy just to hand over for some final comments before we take any sort of questions or reflections on the report. Thank you.
Thank you, Lisa. That's great. Well, first of all, we obviously know that this model works, otherwise it wouldn't be being rolled out in 21 local authority areas, and obviously this report shows that it is working here in Dorset. I'm sure this is all very close to our hearts. in terms of the remit of this particular board, obviously we're always talking about prevention and we're always talking about working organisationally. So this seems the absolutely right place and right time to have this discussion. So on the basis of what we've read and what we've seen, I'm sure everyone here thinks this is brilliant. We need to carry on doing it. We need to roll it out across the rest of Dorset, and we also want to take it to our care leavers. That's obviously what we all want. But the question fundamentally is, within the financial envelope, can we actually work together to make that happen? So obviously we need really detailed conversation with our health colleagues, with our police colleagues, etc. And also particularly, I mean, obviously internally between children's and adults in terms of the care leaver dimension, because the costs to the system throughout of addressing substance misuse, domestic violence, mental health and family breakdown across the system is just massive. So that's rather an impassioned rather than a logical plea for a conversation to really begin, not necessarily here, but a commitment to start having that conversation cross-departmentally and cross-organisationally as soon as possible, really. Thanks.
Lovely, thank you. Thank you both. Thoughts and comments?
Julia.
Oh, Julia.
Hello, if you don't mind me coming in, I don't think anyone can argue with the ambition of us working closer with people in real complexity. But can I be a critical friend in this space? And please take it as a constructive critical friend. When I read the report, I felt the evidence and the evaluation of other local authorities was really sound and robust. But I felt the evaluation of the work that had been done in Dorset was very much based on the implementation rather than a really hard evidence base around how we'd made a sustainable difference to people. And I think that's because it's such a short rollout period. And so I'm wondering whether it's premature for us to be saying roll it out across the county, particularly as we're now looking at the consideration of how we work differently with care leavers. And they are absolutely a group of people that we need to work differently with. Adult social care is committed to finding a better way of doing that. But I would want to understand in a bit more, I think I'd want a harder base for the existing pilot in Dorset. And then I'm absolutely open to those conversations around how we look at the care leavers work, because we're looking at that in the transitional safeguarding arena. So I'd want to know what's the interface between transitional safeguarding and this initiative so that we don't have duplicated work trying to tackle the same thing. So it's not a no, it's just I'm wondering if this is coming too quickly for a decision about next year with a commitment to funding without some of those conversations having taken place in the detail and depth that perhaps they need to.
My understanding, this is not a formal decision. It's an ongoing conversation. So I think those comments are very welcome and will be part of the ongoing conversation. I'm getting nods. Any other thoughts, comments? Lisa Reid. Oh, Lisa.
Thank you. I think just to kind of reassure that we have had a huge amount of information from our families that have talked incredibly positive about this. And we've got some case examples that have been able to evidence that. We obviously, for confidentiality reasons, can't provide all of the detail into that. But we are certainly assured of just the level of impact that this has had for families in being able to keep them safely at home and to be able to manage risk at a much lower level of intervention. So not needing to necessarily go into court proceedings, not always needing to start child protection or being able to reduce child protection, and also preventing our children from coming into care of the local authority. So it has enabled our families to safely stay together. And I think it is represented within that report. And obviously what I'd referred to earlier is obviously there has been quite considerable evaluation from a number of local authorities that have implemented the same model and the same approach.
Thank you. Sam?
you, Chair. So I think this is a model which we, as you know, support, and we have endorsed, and we've supplied some public health funding into the model. I just wanted to make a few comments on how we're working as a system, because I think this has exposed a really important point, which is the Health and Wellbeing Board is a partnership board. It's not an executive board. Previously in the meeting, Patricia talked about this idea of a place leadership team. We need to be able to solve the challenge of how we understand what are the most important things to work on together, and how we have better conversations about how those interventions are going to be resourced collectively as a system. So I think from a kind of priority perspective, and is this the right thing to be doing? Absolutely, and the board need to be cited on that. But I think we've got more work to do about how we get into some of those executive decisions and those functions around things like joint commissioning, for example, in the sort of the Dorset Council place, if that makes sense. Just one other issue, if I'm sure you're aware that because public health will be separating, there is a risk around that current public health funding, and it will only be guaranteed until the end of 24-25, because we don't yet know what the budget position will be in 25-26. So we do need partners engaged in this issue, and we need to find a way of getting some sort of recurrent sustainable funding into the model if it's going to continue. But I just wanted to kind of raise that issue of the Health and Wellbeing Board being partnership space rather than an executive board.
Teresa.
Thanks, Steve. I think it's really timely because I'll be frank, we've been to the ICB with this proposal. We've been to SLT with this proposal. We came here to make sure that we've kind of got real sign up and join up, because it's really important that everybody has absolutely in all of those places seen the proposal before it started, seen the validity of the existence of the previous research. The early research is absolutely early, really important to bring that early. It's really clear. It's the same University of Bedfordshire that's done lots of the other research for others. So I would really welcome clarity around where our people can bring work for decision making that sticks. Because I think there has been, so we came to the ICB and the message was, yes, this is the approach that we think is the right way to go for those very complex families. The extension of care leavers, obviously there's some care leavers that will be part of the transitional safeguarding piece, Julia, but 500 care leavers won't all be. And there's an issue around kind of what we know is mental health issues around our care leavers. Over 50% of them are identifying with mental health challenges. They are appearing in our hospitals on a daily, weekly basis. This isn't something that's not exhausting the system at the present time. And what we've taken the kind of first cut into this to say is that actually, given the early success, but clearly well evidenced success of this model already, it might be really timely for us to think about that. We've had all those conversations with providers who are experiencing all of those admissions and challenges around our care leavers, and some really good conversations around that in terms of, yes, they'd want to kind of see that come forward. So I think this is, it's the new kind of a Health and Wellbeing Board chair, and thinking about the ICP and its change. It's important for us, I think, to be really clear with our executive colleagues around where they bring things for decisions.
Fantastic. Patricia.
I echo Teresa's sentiment. It's been to the ICB and we've agreed it. I think in the context of Sam's comment, I think this is more about the fact that we need to have a broader conversation outside the Health and Wellbeing Board, which is what's the function of the place leadership? What's the plan going forward, and where do all these constituent pieces of work fit within that, and how do they report up in a comprehensive way through the place leadership teams, up through the Health and Wellbeing Board, and then how does the Integrated Care Partnership just keep a handle on it all in terms of both local authority boundaries. So I think that conversation we can have outside, but I'm happy to support the paper that Teresa's put forward because it has been through the ICB.
Yeah, one of the things that I'm very keen on is that we streamline a lot of what we do and avoid some of the snoring that's going on. So again, I think we're singing from the same hymn sheet in that. With which I think it's appropriate to bring the discussion to a close and move on to the next item, which is the work programme. The work programme from the coming period. George and I have talked about that, but rather than actually formally agree it here, there's some change as a new chair. There's some changes and some things that I'd like us to consider. So can I bring that forward as a future point with maybe some suggestions for that? There's no exempt business that I know of. So I think that actually brings the meeting for today to a close. Thank you so much for being a part of today. Thank you everybody for the contributions. Particularly thank you to the staff teams who have just excelled themselves in not just the quality of the paperwork, but the passion in which they've been put forward. And especially thank you to George for holding my hand through my first board meeting today. Thank you all. Have a good afternoon, what remains of it. Thank you.
Thank you.